Have you been curious about using AI for public health? Well, my guest on this episode leads AI training programs, helping evaluators and public health professionals integrate AI tools to enhance their work. You're listening to the PHEC podcast, episode 391. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I'm about to introduce you to a public health professional who leads AI training programs for public health professionals. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations and government agencies that serve Black, Indigenous, people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website at DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links will be provided in the show notes as well. Now, I'm excited to introduce you to my guest on this episode. Many of you already know who he is. He has been on this podcast before, back in episode 244, which really sounds odd to say, way back in episode 244, but we're recording 391 at this time, so it's been quite the journey with the podcast. But he was back on episode 244. We published that episode in early part of 2022. So a few years back. We recently met in person for the first time and finally had the opportunity to chat face to face. It's always nice when you finally get to meet one of your online connections in person, right? Well, we had the chance to catch up on work and family, and I'm really excited to have him return to the podcast and share more of his journey with us. So let me formally introduce him, and then I'll connect our conversation. Brad Krueger is an equity-focused evaluator and AI trainer with extensive experience in project management, program design, and data systems. He has worked with county health departments, nonprofits, and state agencies, emphasizing support for disenfranchised communities through effective data collection and presentation. Brad leads AI training programs, helping evaluators and public health professionals integrate AI tools to enhance their work. Let's connect my conversation with Brad right now. Hi, Brad. How are you?
I'm doing well today. How are you, Dr. Huntley?
I'm good. Welcome back to the podcast. I love being able to say that.
Thank you.
We were sitting here trying to chat about how long has it been? By the time we actually release this, I'll have figured it out. But we're guessing somewhere around 21, right? 2021, somewhere in there.
Yeah, that sounds about right.
Well, welcome back to the podcast. It's really good to catch up with you. In fact, we saw each other in Minneapolis just a couple months ago, and it was great to see you in person for the first time.
Yeah.
Great. Well, why don't you just briefly introduce yourself, tell everyone a little bit about what you do and yourself. We'll just jump in.
Sure, that sounds great. Well, thank you for having me back. It's fun to have these conversations. It's been fun to follow the podcast and listen and see some other names along the last couple of years that I have had the chance to meet in person. And so my name is Brad Krueger. I do program evaluation with nonprofits. I started Krueger Consulting in 2020, a great time to start a business, and have been working with counties and health departments, nonprofits, tribal organizations, and helping define and then ultimately measure what success looks like for their organization in their terms for their communities, doing some learning and development work based off of that, and ultimately doing some reporting to their funders in their community.
Yeah. Important work. I remember certain parts of our interview from before. Like I remember you were in Chicago. Do you still live in Chicago?
Mm-hmm. I do live in Chicago. I'm in a different office than I was then. I was maybe 3 miles west. Now I'm a little closer to the lake, but still in Chicago. And I don't know if you just heard behind me, but there was a siren going, which is very Chicago.
All the action.
Mm-hmm. Yeah. Yeah.
Nice, nice. Well, I love to ask this question. And I know it's been a few years, so I'm going to ask
Mm-hmm.
again, just a little bit about how you came into public health.
Mm-hmm.
When did you first hear about it? And, how did you end up, at this point?
Yeah.
Share a bit of your journey.
I'm happy to share that. I'll have to go back and fact check myself to see how consistent with this answer I am over the years. But I grew up around medicine. My dad was a family practice physician. And so always was kind of in that world, curious. And my undergrad is in biology. And so very close to the sciences, very involved there. My plan was go to med school. Medical schools had other thoughts for me. And so ultimately I landed in public health because one of the schools that I interviewed at had a really strong public health program. And there was a clear interest in the folks there and in the conversations within public health around this idea of kind of one-to-one versus one-to-many and being able to have a bigger impact while also leaning into the skill sets that I think that I have. I'm a very interpersonal relation person. And so medicine, I think, is a great fit for that. But I also think public health brings out those skill sets in us all the while leaning into the hard sciences, very similar to medicine. And so I kind of backed my way into public health shortly after my undergraduate career. And while I was in grad school for a master's in public health completely online, it took me, I think, 4 years to complete it. So you can tell I was really dragging my feet with that program. I was working in public health. And so I worked for a county health department in Indiana, worked for some smaller agencies, and fell in love with the work that is public health, specifically within program evaluation there and supporting public health entities in this like juncture of people and science and numbers and spreadsheets, but also voices and thoughts and feelings. It just felt like a good combination for both the skills and expertise that had been given to me, but also the type of work that I like to do day to day. And so since then have stayed pretty close to public health. I do a little bit of education, program evaluation, but we'll pretend for the sake of this conversation that I just do public health.
That's great. I do remember bits of your story. I remember about your father as a physician and, your segue into public health. And this is great. So you are a full-time consulting firm, and like all of us in this consulting field, it doesn't really matter how much you niche down. We still stay flexible and a little nimble, at least we need to be, so that we can pivot as we need to and as things shift around in our world. And I know that program evaluation is kind of near and dear to your heart, but I also know that you've been dabbling in another space that's got my attention and a lot of folks' attention around AI. And how did it get you?
Probably similar to how it got most of us. And so there's this within program evaluation, most people from the outside who have not done program evaluation think that I'm probably in some sophisticated database, writing computer code, analyzing these massive data sets day to day. The reality is I do that very, very infrequently, if at all. There are people who are program evaluators who do that, but they're working at like the federal level or the international level where the data just allows that type of work. I'm working much more with community alongside of community in the work that I do. I don't know, that maybe as an aside. The hard science is not where I come from, but I certainly enjoy that work. And so when the chatbots came out, when OpenAI released ChatGPT, what was it called, 1 then? I think in late 2022, I was like, Brad, this is it. This is the coolest thing ever. This is going to change everything. This is your chance to kind of be at the frontier of this technology and figure out a way to integrate it into your work and help millions. And then I quickly grew frustrated with it. I asked it for very simple things and it did terribly. And like many of us did in 2022, the story that I recount often is I asked it for a vegetarian chili recipe And this is probably in like October of 2022. And it gave me a recipe, but the first ingredient was ground beef. I was like, this thing that is promised to revolutionize our world is not going to do that. And so I was like a little bit skeptical of it. I knew that there was power. Of course, it was going to get better. And so I played around with it. I told everybody that I knew about it. You got to try it. You got to try it. You got to try it. Create your free account in late 2022. And then in 2023, I fell way behind. I felt overwhelmed by every new release, every new product, every new news conference, every new cycle, all these software development. You have to use this thing, this Excel bot. You have to use this add-in. You have to use this new platform. Oh, they just released a new model. And it didn't make any sense to me because I don't speak that language. I didn't understand what was happening. And yet I knew in the back of my mind, like, Brad, you should be paying attention. So I beat myself up for like 6 to 7 months about this, feeling overwhelmed, falling behind, but also you are in a space in life, consulting, where you have the ability and the time to spend learning about these things. And yet it's too big. Where's your spot in it? How do you do that? And then in the fall of 2023, I was at the American Evaluation Association conference in Indianapolis and attended all the sessions on AI. And some were great, some were not great. But one that was like really, really helpful and foundational to me was a talk of some experts who had been doing AI before chatbots came around. So they had a more firm understanding of what it was and what it wasn't. And they had seen this like marketing behemoth behind it that is now like screaming it from the rooftop and you can't avoid it anywhere. And they had a little bit of a call to action to us evaluators in saying that you will often hear that your field, whatever you may be working in, needs AI. AI is going to change the way that you work. And they flipped it on the head and said, AI needs evaluators. It needs the values. It needs the competencies. It needs our skill sets. It needs our understanding of history and context to inform the development and responsible rollout of these AI tools. And so I left that session still feeling completely overwhelmed, but feeling like there's some level of responsibility for me in this space to figure it out, to have a voice, to have an opinion beyond just overwhelm. And so stepping into 2024, I've spent hundreds, if not thousands of hours learning about it, trying to find my place in it, trying to find out where it's good, where it's bad, how do we use it well, how do we get good results, how do we do that responsibly and intentionally. Yeah, so that's maybe my journey to AI. I still don't know computer science. I still don't fully understand what a large language model is, but I have a pretty good grasp on the ways that we can use them responsibly and intentionally and get good results out of them. And so I spent a lot of time in 2024 figuring that out and hope to continue to do that for public health, for program evaluators moving forward.
That's great. I'm really happy to hear that because I don't teach any longer, but I was teaching in public health program online. And I just remember as a professor being, charged to watch out for assignments and work that's being generated by AI. And there's always this defensive watch outs and warnings. I know that in practice, well, there are probably a couple of entrepreneurs in public health that I know are exploring some of the AI tools. So a lot of us, I think, we're curious and exploring. I think what I hear from other industries, maybe more of the government agencies and the structured organizations like that, they're more like, I don't know what that is, but we got to stay away from that. Again, that kind of defensiveness. So I knew that it was something that we couldn't ignore. We couldn't afford to ignore. We as public health tend to lag behind on technology and industry in general. So this is something that we couldn't afford to sit back and ignore and then lag behind on this as well. So I did feel maybe a little bit of responsibility. It's kind of maybe like you described, to at least try to understand and then maybe even explore how it could be used. So I know within my company, we've been just starting to explore some of the ways that it can be useful, but just carefully doing so. Nothing really in depth at all. But I know that I've seen, saw some of your posts about programs and how you were really taking a lead on this. And then, of course, at APHA, you spoke about it and you talked quite a bit. So I did not get to attend your presentation, although I tried. The schedules there are insane. But can you share a little bit of what you shared with folks during that time?
Yeah, certainly. And before I go there, I think to reiterate, at AA, the Evaluation Association, they shared AI needs evaluators. I heard the same thing echoed at APHA, which was in October, just a month and a half ago as we record today. I forget exactly who it was, and so shame on me for forgetting that. but someone else shared around the public health values that we bring to the work are as needed in AI. I think it was the National Nurses Union speaker saying that we as public health professionals need to bring our values to AI, specifically in the softwares that are being used within our field already. Otherwise, they're going to run rampant and we're going to not have a voice in the process. So just to say that APHA, American Public Health Association, reiterated the same concepts. The talk that I got to give at APHA was around an experiment that my colleague Megan and I had done. We did it in February of 2024, where we took 5 of the kind of the big tools that we knew of, like the ChatGPTs, the Google Geminis, Microsoft Copilot, and Formula Bot, and one other that kind of fell off the wayside since then, and said, how good are these tools? Can they actually do our jobs like everybody is saying, or are these really fancy demos and they're kind of actually crummy at it? So we took a public data set that was already public, so we weren't worried about data privacy. We can talk about that later. We gave it the data set. We asked it to analyze it. We asked it what was interesting. We asked it to run analyses and prepare charts and graphs, and then write summaries, for different audiences. And so we did the same prompting for all 5 of these tools and looked at the results. When we did it in February, ChatGPT almost did everything, but none of the other tools could do it all. And they each had their own little idiosyncrasies and nuances. Like the statistical AI tools did better at the analysis and chart development, but did a really crummy job about writing a summary about that data for a program manager. And so it was fascinating to see it in 2024. We pitched this to APHA at their late breaker session. And so I think we submitted in July. And then we ultimately redid the experiment just 2 weeks before the conference. And we did it with 5 tools again. And 4 out of 5 were able to do the entire gamut of things that we asked it to, still with varying levels of quality, but they all did it. And that's in a 9-month difference, 8-month difference, which is absurd. It's crazy how well they're getting at this. So then we ultimately went on to share, like, yes, these tools can do it. No, it can't do it by itself. I wasn't at the beach after I gave it this prompt and then let it run away. So we kind of talked through our learnings of like, yeah, there's probably some savings in time. We argue that quality was better in a few areas. Here's a few things that will help you generate better results. And then here's some like data privacy concerns that you need to be aware of as you use all of these tools too. And so we shared some of that information out.
That's interesting. And I do get it. This technology advances and changes so quickly that you have to just keep up. There's a podcast that I was, no surprise, I follow a lot of podcasts, but there's this podcast that I was listening to that was basically designed to kind of teach what's going on for the people that are just non-tech, make it super, super easy to understand. And they would say at the very beginning, like, listen carefully, don't worry about going too far back because in a month's time, what we talk about could be obsolete. It changes so quickly. So it really, the advancements, which are exciting and a little scary at the same time.
Yeah.
For that type of quick growth.
For sure. I think that's why in 2023 that I was like feeling overwhelmed, because if you don't have a firm grasp, or if you take a month off and then you go read the headlines, or the headlines get shoved in front of you by the way that we live, it can feel like you're 4 years behind, that you're never going to catch up. And yet I don't read the headlines every day. And I know every day that I sit down at my computer with my to-do list, like where I'm going to use tools that are going to help me today without having to go read the headlines every week or keep up with the latest model. Like I know the key areas where it is beneficial for me in today where we sit, December of 2024. That may change in February of 2025, but I'm not worried about that. I know where it's helpful for me today, where I'm getting productivity advancements out of it. I encourage people not to try to understand it all. Get a foundation, find your footing a little bit, and then grab one thing off your to-do list and spend truly 15 minutes trying to use some way to do that task with a chatbot is probably the easiest way to do it. The learning that you will get in that 15 minutes is way better than, no offense to either of the jobs that we're doing right now, but to a podcast, because it'll be specific to what you're doing. You'll understand, you'll figure out some of the nuances, and it changes. So if you're listening to this in July of 2025, the tools that I'm going to recommend or share today may look or feel or do different. They will have different functions. They will do different capabilities.
I agree there. Then my organization, we've decided on, Olaf and I are down to 2 that we typically will use, but I'm constantly open. I don't necessarily jump on the shiny, bright object syndrome thing, but between those 2, we'll use those and work with those. And kind of master that to the point that it really does help improve our productivity across my whole team. And then just kind of entertain or be open to trying something else. I think that's probably the best balance. We've got, one or two that we are locked in, that we, consistently are our go-to. And then we'll look to explore with something new and then just revisit that every so often.
I think that's really wise. One of the things that I talk about in almost all of the talks that I give around AI is this thing called the Gartner hype cycle. We don't have it in front of us today, but you can Google it. You'll see it. It's the same kind of cycle for any new technology tool software. And it starts with an innovation trigger, and then you go way up in expectations, right? As soon as something new comes out, you get really, really excited about it. We all think it's going to change the way that we work every day. A little bit after that, you go down this big trough where your expectations are low because you tried it and it failed and you didn't know how to use it and it didn't know how to guide you. And so those like, okay, really cool tool. I'm really, really excited about it, but it worked really terrible for me. And then after that is what they call this, oh boy, Brad, not the plateau of productivity. That's when you get over there. Oh, I'm forgetting it. Anyway, there's a slow, steady slope where you begin to climb and you begin to find, okay, it saved me a little bit of time here. Oh, it helped me here. Okay, it helped me here. And that takes time, right? It's not instant like that innovation trigger, but slowly but surely you find your footing in it, right? You find your comfort level. You find the thing on your to-do list that you know you can use that new software for, that new tool for. And it doesn't happen at once. It happens in slow, steady increments. And that's the way that truly these technologies become integrated with our work. And this is true across technologies, just not artificial intelligence. Email was the same way. Internet was the same way. If you think back to when the first email was sent or when email got developed, they probably thought it was the coolest thing in the world. And then they realized me and that guy across the office are the only two people with an email. This is not going to be that helpful. And then slowly but surely, internet access got better. More and more people got emails. It became a little bit quicker. We understood how to communicate. Then we began to manage inbox and get rid of junk mail. And it became embedded in our daily work. But that took time. The invention of the email didn't change society overnight. And artificial intelligence is following that same curve where it is really powerful in the tool that it is, but it's going to take slow, steady steps from each of us as we integrate it into our day-to-day well.
So you mentioned a little earlier about recommendations. Do you have any recommendations for now, given the,
on tools
for now, based on what
this is one of my favorite fun facts. And I think maybe one of the more misunderstood things. And even I don't fully understand how this all gets integrated behind the scenes. But if you go to one of the websites that catalogs tools is futurepedia.ai or .io or something, and there are 10,000 tools listed on this website. Neither of us have time to review 10,000 tools or pick which one is going to make the best chart for me. The thing that they don't say on the website and that most people won't tell you is that those 10,000 tools are primarily based on the same 3 or 4 underlying large language models, which is the science behind the actual tool. Like OpenAI is ChatGPT. That is because of the one, they were kind of the first player. 2, they have ability to tie into the backend through APIs. And so all of these tools, let's say, 8,000 of the 10,000 are built on top of OpenAI's model. So it is the same underlying science and math and model, just painted and presented to you differently. And that was really important to us when they first came out because ChatGPT wouldn't let you upload. It wasn't connected to the internet. It wouldn't make images. But slowly and surely, as they develop and feel comfortable internally, they're allowing access to those things externally. And so I tell people not to look at the 10,000 list. I tell people to try ChatGPT, Claude, which is Anthropic, Gemini, or Copilot, which are the 4 major models out there. All of them are somewhere between $0 and $50 a month. And try those tools. They're the broadest in that they do the most things. They're the simplest for you and I to use if we're not technology experts or computer scientists. And they're crazy powerful. The work and the tests that they pass are incredible. And so personally, day to day, there's one other person at my consulting agency. She uses ChatGPT and I use Gemini. And we argue back and forth about which one is better. Probably the real answer is ChatGPT is better, but I'm dug in on Gemini, so I continue to defend it. The other really good tool out there, and I think specifically for public health, is Claude, built by Anthropic. They're intentionally going slower with their development, being a little bit more cautious around ethics and responsibility and safety as they develop their tool. And so for a lot of reasons in public health spheres, that makes a lot of sense as a tool. Because they're going a little slower, they lagged behind in some of their features. But again, things change month to month. And so I would definitely start with one of those 4 tools. ChatGPT or Claude are definitely the ones that I would start with. The only reason I would recommend Google Gemini or Microsoft Copilot is if you're using their suite of software already. If you're already a Google Workspace super user or you have Microsoft 365, There is some ability to like sync across tools and platforms, which is nice, but being a little bit skeptical of privacy and security, I like that ChatGPT is not connected to everything in my Google Drive. So I intentionally have those separate right now.
Nice. Okay. Well, we use ChatGPT and Claude.
Yeah. Good choices. You did it. Yeah.
And they're different enough that they work well together. Sometimes I like the writing that comes from Claude much better than what we get out of ChatGPT. But I think my team overall, the go-to is ChatGPT with them.
Yeah, I think it has the broadest set of functions right now. Claude is intentionally going slower. So like its uploading was slower. Its customization was slower. It's kind of like co-editing was a little bit slower. But all of those things I think are here right now, or they will be very shortly.
Well, this is very, very helpful. So, and I think for our listeners, especially as people are just, wherever you work, if there's this fear, which I think still exists about what to do with it and just staying away from it. I don't think we need to stay there in fear. I think there has to be some exploration happening. We can't lag behind here as an industry for sure. Can you speak to a bit more about for your clients or someone that is potentially, looking for help or support? How are you helping your clients with the use of AI? I know you may use it with some of your work, but are you actually helping to teach these organizations and helping them to find out how to use that and to incorporate use for their particular situations?
Yeah, absolutely. No. We use it day to day in our work as program evaluators, as a business owner. I use it day to day, but we also spend a lot of time helping others do that. I think there's so much noise and like chaos that I love to help people like cut through that and reduce it down so that it's not so daunting. You may have heard the term of bring your own tool to work. And it's essentially that if you work for an agency or an organization of like 10 or more people, probably 3 or 4 of those people are using some level of AI in their professional work for your organization, whether you know it or not. And they're probably different and they're probably not trained and they're probably not following the policies that you would want them to follow. And so a big part of what I think we need to do as business leaders, as public health folks, is have these conversations in the open so that people are understanding and on board and can make informed decisions as opposed to like pretending that it doesn't exist, because it does. Like people are using these tools. It's showing up in work in lots of ways, good and bad. And if we're not talking about it, or if we're scared about it, or not having that conversation in transparency, I think it's doing a disservice to us. And so the work that we're doing with other organizations is like cutting through the noise. What is AI? Is it this purely an evil thing? Yes or no? Okay, we have some nuanced understanding of that. Okay, if it's not, is it going to be a part of our work moving forward? If so, in which ways? What I don't do is build things for people. That's not my role. I'm going to suggest that we talk through the ways in which it could be helpful for our organization, the use cases for different levels of your staff or your organization, and then building some policies and or training your staff on those appropriate tools so that we're using them consistently, so that we're using them well and doing some of that work. And so, yeah, I hope that answers the question.
Yeah, it does. And that's what I was actually hoping to hear, because I would love to refer people in your direction and refer them to you to just start to explore, what's possible. And I encourage people to do so. So we'll make sure that we have, of course, your information in the show notes so that people can connect with you and just have those early conversations and decide, they can sit down and talk to you about, well, this is what we're thinking or we're wondering, and just kind of go from there. I think it's wonderful to have a resource that's in public health to help our other public health organizations to, demystify this whole AI technology world and space that we're in.
Yeah, I think if you're a leader in your organization and this is like your task to figure out AI for our company, man, that's overwhelming, because you're going to start Googling, how does my organization think about AI, or which tools are right for us? And I don't think that's the right starting place. Like, you've got to understand it yourself before you go and try to build it for your organization or adopt it for your organization. And so starting from some of those like first principle elements and thinking through that, trying it for yourself, having a foundation, and then building on top of that, I think is really important. And so you will find very little of that out in the ether, out there in the Google, because it's not there. The AI companies are largely the ones controlling the information that's out there right now. And the big opportunities for them are in these massive, massive corporate opportunities. And so they're pushing that level of information. They're not tailoring information for the public health leader. for the program consultant, for the program evaluator. And so I hope to be like a listening ear of like, you are thinking through this. Here are your concerns. Yeah, those are all warranted. Let's talk through each of those and begin to build some foundational understanding so that you can take a meaningful step towards using it or not using it. And then whichever you're doing, like doing that informed. I don't think that everyone has to use AI all day, every day, but you should know why you're using it or not using it beyond, I don't understand it. And so we hope to build that competency in others.
That's wonderful. This is such a great conversation. I'm trying to be mindful of time because we've already put a big dent in here, but you shared so much and brought a lot to light. I think I like the niche you're in or that you're exploring. And I do encourage our listeners, especially like you said, you're leader in organization. This is something that you've been wrestling with or trying to figure out. Now you have a resource that is also a public health professional that can help shine some light here. So, well, what is one bit of advice that you would like to leave with our listeners who may be, looking to explore this right now or curious, or maybe they've been afraid and now they're hearing this and they're thinking, I don't know. What bit of advice would you leave for anyone regarding public health and AI?
It's a good question. I think maybe going back to where we started of it is overwhelming. It is loud. It is intimidating. There's a lot happening. And yet you don't have to be a part of all of that to have an understanding, to have a foundation, to benefit from it. And so I think like the call to show up as public health professionals with our training, with our expertise, with our understanding of the ways in which technology has previously been leveraged against communities that we're trying to support. Like it, to some level, it is our responsibility and our opportunity to step up and be a part of that process. I think that spending time with it is the way to start. You can't do that from the sidelines, right? I'm not saying you have to be a super user, but you should have some foundational understanding. And so I think that the call to action is if you have yet to spend an hour of dedicated learning, I think that you should go do that. And I think don't Google, learn about AI. Like find a trusted voice or an expert in your circle and send them a handful of questions and ask them to respond to you or get them connected with somebody. Like I think we need to hear advice from people in our field who we trust. And so I would spend an hour trying to do that. And I think that goes a long ways in elevating your voice as a leader, as a public health professional within this artificial intelligence world that we are all interacting with, whether we like it to or not. It's in every tool we're using. And so we might as well understand it.
Yeah, that's great advice. A great, great tip. I agree with you. Well, Brad, I've enjoyed catching up with you again. Thank you for taking time and joining me on this episode and catching us up with what you've been doing and what you're doing now. We'll be sure to, of course, provide links in the show notes. I really enjoyed this time today putting this episode together.
Yeah, thank you for having me. I appreciate the work you continue to do in elevating these conversations. And so I enjoy it.
Thanks, Brad. Well, I really hope you enjoyed that conversation as much as we did. Brad is a true leader and innovator and is having a big positive impact on the communities that he serves. I encourage you to connect with him and learn more about the work that he's doing. Now, if you're already connected with him, let him know that you heard this podcast episode and how much you liked it. I think he'll appreciate all of you reaching out to him. You can find the links to connect with him on the show notes page. Now, the show notes page for this episode, which is episode 391, can be found at phecpodcast.com. Once you're there, just navigate to episode 391 to find its show notes. One more thing before we go. Please take a moment and share this episode with a friend. I'm sure that you know someone, at least one person who'd be interested in hearing this conversation. And if you're listening now in the podcast app, you can easily share this episode through a text or share it directly to social media. At the bottom of our show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.